Anxiety isn't just a fleeting worry. For many, it's a constant presence. That's particularly true for those living with Generalized Anxiety Disorder, or GAD. This disorder affected a staggering 301 million people globally in 2019, as reported by the World Health Organization, WHO. GAD does not discriminate. It can affect anyone, regardless of age or background. For those with GAD, everyday thoughts often spiral into a whirlpool of worry, making it difficult to focus on tasks or find peace. Whether it's anxieties about school, work, or routine daily tasks, the disorder can turn straightforward activities into overwhelming challenges. Despite the challenges, there is hope. Effective treatments like therapy, medication, and lifestyle changes can significantly improve the quality of life for those affected. Communities and support networks also play a crucial role in helping individuals feel less alone in their struggles. GAD is deeply ingrained in the lives of many, shaping how they live, work, and interact with others. It's a global issue that affects diverse populations, silently but profoundly. Yet, with increasing awareness and better access to treatment, there's a growing sense of hope that those affected can lead fulfilling lives. This sparks curiosity about its widespread influence and the potential for overcoming the challenges it presents. The goal of this video is to educate about generalized anxiety disorder, demystify its symptoms, and share coping strategies. Through this knowledge, we aim to empower viewers to better understand and manage their anxiety, or support others who are facing similar challenges.
Have you ever felt worried or tense about something like a job interview or a major exam? That flutter in your stomach, the racing thoughts? That's anxiety, a familiar feeling for everyone. But what if that feeling didn't go away? Welcome to the world of Generalized Anxiety Disorder, or GAD, a place where anxiety doesn't just visit, it moves in. For someone with GAD, worry isn't tied to specific events like a speech or an exam. It's a constant companion, casting a shadow over everything from personal health to daily chores, without any clear reason why. Unlike the usual anxiety that comes and goes, GAD sticks around. It's like having an alarm system in your brain that's always on high alert, even when there's no danger. In the brain, this relentless worry can tip the balance of neurotransmitters, those chemicals that send messages between nerves. This imbalance can make relaxation seem like a foreign concept. The effects? They're more than just mental. Imagine being so consumed with worry that it wears you out physically. Fatigue, muscle tension, even sleep problems are just the tip of the iceberg. But here's the intriguing part. Why does this happen? What makes GAD different from normal, everyday anxiety? Scientists believe it's a complex mix of genetics, brain chemistry, and life experiences. While normal anxiety can be a healthy response to stress, GAD is a deeper, more chronic condition. It's not just about managing stress, it's about managing a condition that can fundamentally alter the way you experience the world. The good news? GAD is treatable through therapy, medication, or simple lifestyle changes. Those with GAD can find relief and regain control over their lives. If you or someone you know is wrestling with a storm of worry that won't clear, remember, help is out there. Understanding GAD is the first step towards turning those storm clouds into just a passing weather. Keep watching as we dive into the specific symptoms of generalized anxiety disorder in our next segment. Understanding these signs is crucial. It could be the first step towards seeking help and finding relief. Don't forget to subscribe and hit the notification bell for more engaging content on psychology, mental health tips, and other fascinating topics. Stay tuned and make sure you don't miss out.
Hey everyone, understanding the symptoms of Generalized Anxiety Disorder, or GAD, isn't just empowering, it can truly make a difference. Whether it's for yourself or someone close to you, knowing what to look for is the first step toward management. Ready to dive deeper? Stick around as we explore the symptoms, causes, and triggers of GAD in our next segment. You won't want to miss this.
Okay, we covered what Generalized Anxiety Disorder, or GAD for short, is all about. Now let's get specific. GAD can show itself in two main ways: through how we think and feel, or mental symptoms, and through physical sensations or physical symptoms. We'll also explore what might be behind GAD and what can trigger those anxious feelings. Start with the mental or psychological symptoms. Excessive worry about everyday things. An individual with GAD may constantly worry about their health or the health of loved ones over minor symptoms that most people would consider normal or insignificant. For example, a simple headache might lead them to worry excessively about serious illnesses, leading to frequent doctor visits or constant health monitoring. Difficulty controlling worries or feeling nervous. Someone with GAD may experience overwhelming anxiety about financial stability, leading to excessive worry about spending money on everyday items. This person might repeatedly check their bank accounts, stress over budgeting every small expense, or worry incessantly about future financial emergencies, affecting their ability to make confident financial decisions. Restlessness and feeling on edge. The constant feeling of being on edge can make it difficult to fall asleep or stay asleep. Individuals might frequently wake up during the night, feeling restless and unable to calm their thoughts, which prevents them from getting restful sleep. Difficulty concentrating. Someone with GAD might struggle to stay focused to finish an important work project. The task that normally takes an hour now stretches into several. This ongoing struggle to focus is a common challenge for those experiencing the symptom of difficulty concentrating, often seen in individuals with GAD. Irritability. A person with GAD may react with disproportionate irritability to small, everyday frustrations, such doing daily chore or a minor delay in public transportation. These small irritants can cause them to snap or become upset more quickly than usual. After examining the mental effects of GAD, let's explore its physical manifestations, which can be equally challenging for those affected. This physical symptoms of GAD often a response to the excessive worry and anxiety that characterize GAD. Muscle aches and tension. When a person feels anxious, their body often prepares to respond to a threat. This is known as the fight or flight response. During this response, muscles may tense up to protect the body from injury or harm. If a person is frequently anxious, like in GAD, their muscles may be tensed up more often than not. This constant muscle tension can lead to muscle aches, which are a common physical symptom of GAD. Fatigue. Fatigue in the context of GAD is a type of exhaustion that goes beyond ordinary tiredness. It's not just about feeling sleepy, it's a profound weariness that doesn't improve with rest. Trouble sleeping. It is when a person finds it hard to fall asleep or stay asleep due to excessive worry and anxiety. Gastrointestinal upset. It refers to problems in the digestive system that are often related to anxiety and stress, such as stomach pain, nausea, vomiting, diarrhea, constipation, and indigestion. It's not just one symptom, but a collection of symptoms that affect the stomach and intestines. Trembling or shaking. When someone is experiencing a lot of anxiety, their body might react with physical signs like trembling or shaking. This happens because the body's nervous system is on high alert, preparing for what it perceives as a threat, even if there isn't an actual threat present. Headache. The constant worry and stress that come with GAD can trigger muscle tension in the head and neck, which can result in a headache. Additionally, the stress response can affect blood vessels in the brain, which might also contribute to headaches. Palpitations. When someone is anxious, their body's fight or flight response can get activated. This response prepares the body to either face a threat or run away from it. Part of this response includes the heart beating faster than normal, which can feel like the heart is racing, fluttering, or even skipping beats. This sensation is what we call palpitations. In GAD, because the anxiety is persistent, the person might frequently feel these palpitations, which can be unsettling but are generally not harmful. Under the guidelines of the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, diagnosing Generalized Anxiety Disorder, GAD, hinges on specific criteria. For adults: 1. Persistent excessive worry about various aspects of life, lasting at least 6 months. 2. Difficulty controlling these worry. 3. Experience of 3 or more symptoms, such as restlessness, fatigue, difficulty concentrating, irritability, muscle tension, or trouble sleeping. For children: 1. Persistent excessive worry lasting at least 6 months. 2. Difficulty controlling these worry. 3. At least one symptom, such as restlessness, fatigue, difficulty concentrating, or irritability, must be present. These symptoms must significantly disrupt daily activities or relationships. Remember, only qualified healthcare professionals can accurately diagnose GAD after a detailed assessment, ensuring the right approach to treatment and management.
Several factors contribute to why someone may develop Generalized Anxiety Disorder, or GAD. Understanding these can help us identify and manage anxiety more effectively. Core causes. Genes. Imagine genes as instructions passed down from your parents that influence how your brain is built. Some genes might affect neurotransmitters, like chemical messengers involved in anxiety. Variations in these genes, like having slightly different spices in a recipe, could make you more prone to feeling anxious. Let's say your parents both tend to worry a lot. This doesn't guarantee you'll have GAD, but you might inherit a tendency to feel anxious more easily. It's like inheriting a tendency to be tall. You might get it, but you might not. Brain chemistry. GAD is also linked to imbalances in brain chemicals. These chemicals, like neurotransmitters, act like messengers in your brain, influencing mood and anxiety. When these messages get disrupted, it can lead to excessive worry. Imagine a phone conversation with crossed wires. You might misinterpret messages and feel confused or frustrated. Similarly, imbalances in brain chemicals can lead to misinterpretations in your brain, making you feel anxious even when there's no real threat. Additional contributing factors. Life experiences. Stressful or traumatic events like childhood abuse, bullying, or major losses can increase your risk of GAD. These experiences can leave a lasting impact on how your brain perceives threats and regulates emotions, making you more prone to anxiety. Personality. Traits like neuroticism or a tendency to experience negative emotions can make you more susceptible to GAD. People who naturally worry more or overthink situations might be more likely to develop GAD when faced with other risk factors. Medical conditions. Certain medical conditions like chronic pain, hormonal imbalances such as during pregnancy, menopause, or due to thyroid disorders can contribute to anxiety symptoms and sometimes even trigger GAD. Substance use. Drugs and alcohol can worsen anxiety symptoms and even contribute to the development of GAD in some cases. It's important to understand, these factors often work together in a complex way. Genes and brain chemistry might create a vulnerability, while life experiences, personality, and other factors can act as triggers. Common triggers. While the core causes lie in genetics and brain chemistry, several common triggers can worsen anxiety in people with GAD. Stressful situations. Work deadlines or performance reviews. Financial worries or money management. School exams or academic pressure. health concerns such as yours or loved ones, relationship problems or conflicts, social events or public speaking, making important decisions, daily hassles such as traffic, long lines, etc. Negative thought patterns, catastrophizing such as assuming the worst outcome, mind reading such as thinking you know what others think, fortune telling such as predicting negative future events, dwelling on past mistakes or what-ifs, focusing on worst-case scenarios, environmental factors, loud noises or crowded spaces, changes in routine or schedule, caffeine or alcohol consumption, lack of sleep or poor sleep quality, certain medications or medical conditions. These triggers can vary from person to person. What triggers anxiety in one person might not affect another. However, by understanding your individual triggers, you can develop coping mechanisms to manage your anxiety and improve your quality of life. If you're struggling with GAD, talking to a mental health professional can be extremely helpful. They can equip you with strategies to identify and manage your triggers, ultimately reducing the impact of GAD on your everyday life.
We've explored the challenges of generalized anxiety disorder, but there's hope. Science offers proven methods to manage GAD brilliantly. Imagine living a life where anxiety doesn't control you. In the next segment, we'll unveil these powerful treatment strategies. Subscribe and ring that notification bell to stay tuned and discover how to take back control of your life. Let's delve into these treatments and explore the path to a more liberating future. Treatment options for generalized anxiety disorder, or GAD, typically include a combination of psychotherapy, medication, and lifestyle changes. Treatment for GAD must be tailored to the individual's specific needs and circumstances, as each person experiences GAD differently and with varying severity. Psychotherapy treatments. Cognitive behavioral therapy, or CBT. This therapy helps you identify negative thought patterns that fuel anxiety and teaches you to challenge them. You'll also learn coping skills like relaxation techniques to manage anxiety in the moment. CBT is a powerful, evidence-based approach that equips you with lifelong tools to conquer GAD and live a calmer life. While CBT is a standout in GAD treatments, it requires your commitment. Regular sessions and consistent practice are key to seeing results, which might take time. To really see a change, you'll need to attend regular sessions and keep up with daily practices. It's a process that takes time. If you're dealing with very intense anxiety or want to explore your emotions as well as your thoughts, CBT might not cover all your needs. Acceptance and Commitment Therapy, or ACT. Forget challenge thoughts, acceptance and commitment. Therapy, or ACT, helps you manage GAD differently. Imagine a river of emotions and thoughts. Acceptance and commitment. Therapy, or ACT, teaches you to accept them, not get swept away. You focus on what truly matters, your values, like kindness or adventure, and let the thoughts flow by. Why acceptance and commitment therapy? It's great if you struggle to control overwhelming thoughts. ACT helps you accept them and live a values-driven life, even with difficult emotions. In a nutshell, ACT empowers you by accepting challenges and living a life guided by your values. Medication treatments. Medication can be a game changer when it comes to managing generalized anxiety disorder, especially if you're dealing with severe symptoms that really disrupt your daily routine. The pros are that medication acts quickly, significantly reduces anxiety, and works well alongside therapy. However, the cons include possible side effects like drowsiness, and while medication primarily manages symptoms, it does not address the root cause. Additionally, some medications can lead to dependence. The types of medication include selective serotonin reuptake inhibitors, or SSRIs, which are often the first choice. If SSRIs aren't effective, serotonin norepinephrine reuptake inhibitors, or SNRIs, are typically considered next. Buspirone is another option that carries a lower risk of dependence. Benzodiazepines offer quick relief but can be habit-forming and impairing. They are typically not a first-choice treatment due to these risks. Choosing the right medication is a crucial step that should be guided by a professional. Talk to your doctor or a mental health expert to tailor a treatment plan that's just right for you. Remember, it's all about finding the safest and most effective path to feeling better, not just quick fixes. Dealing with GAD often means using more than one strategy. Besides therapy and medication, there are also lifestyle tweaks and alternative treatments that can boost your overall plan. Let's dive into these extra options that can really round out your approach to managing anxiety. Regular exercise. Physical activity is a natural mood booster and stress reliever. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Healthy sleep habits. Prioritize quality sleep. Develop a regular sleep schedule. Create a relaxing bedtime routine, and practice good sleep hygiene. Relaxation techniques. Techniques like deep breathing, progressive muscle relaxation, and mindfulness meditation can effectively manage anxiety in the moment. Mindful eating. Eating a balanced diet with plenty of fruits, vegetables, and whole grains can improve your overall well-being and indirectly support anxiety management. Limiting caffeine and alcohol. These substances can worsen anxiety symptoms, so moderation or elimination might be beneficial. Social support. Strong social connections are crucial for mental well-being. Connect with loved ones, join a support group, or seek therapy to build a strong support network.
You've reached the end of our deep dive into Generalized Anxiety Disorder, or GAD, and hopefully you feel empowered. Remember, GAD doesn't have to control your life. With the right treatment plan, you can build resilience, manage your anxiety, and reclaim your peace of mind. We explored CBT for challenging thoughts, ACT for accepting and moving on, medication for faster relief, and lifestyle changes to support your well-being. There's a path forward for you. Don't forget to subscribe for more mental health insights and hit that like button if this video helped you feel less alone. Remember, millions manage GAD and live fulfilling lives. Take that first step today and believe in your ability to conquer anxiety. You've got this.